every type of girl, but your empty eyes seem to pass me by, leave me dancing with myself. So let's sink another drink, 'cause it'll give me time to think. If I had the chance, I'd ask a woman to dance, and I'll be dancing with myself. Dancing with myself. Dancing with myself. If I had the chance, I'd ask a woman to dance. If I had the chance, I'd ask a woman to dance. If I had the chance, I'd ask a woman to dance.
Broadcasting from the Harlan Ford Studios in downtown Okmulgee. You're listening to KOKL, Okmulgee, Oklahoma on 106.3 FM and 1240 AM.
SJ, welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. SJ, Stongo, Gary Fife, Jaho Jifkados, Mvskoke Radio, Mabu Hedget Wechki. Sitting here in the studio is my colleague.
Hello, everybody. It's Morgan.
And we have the privilege this morning of having our Secretary of Health, Mr. Shawn Terry, sitting in with us today. Good morning, sir.
Good morning, guys.
Okay, try that again. Let's see if we can get that mic a little hotter.
Good morning, guys.
No, that didn't do it. Try it again.
Good morning, guys.
We found him, the right button, finally. Nothing like live radio to keep you entertained. We have a couple of things we'll be working on today. Of course, Mr. Secretary Terry is going to give us an update on how the tribe is doing amidst this virus resurgence, how our tribe is doing and what's the future like, and a couple of other myriad questions, I'm sure. And in the second portion of our program, Morgan has...
I have invited the Reintegration program to talk about their Fibreoptic program. They just finished their first 12-week course, and we are going to catch up with them on that and how they did with that.
Now, when you say the Fibreoptic program, it's teaching them how to work on it or work with it, or?
Yeah, so they thought this program was a need in the area because the lines are outdated here, and they're replacing, 3G and 4G with 5G.
Right.
Yes,
right.
so that's what they've been learning.
Oh, boy. And then in 5 weeks, they'll replace that with another one, right?
Yep.
Isn't that how that works? So how many obsolete computers are sitting around that are perfectly good but are not connected? All right, well, let's get on with this. Mr. Secretary Terry, thank you once again for joining us. We appreciate you taking time out of that, what's got to be a ridiculous schedule these days.
It's pretty busy.
Well, let me start off by asking you what's the status of the tribe in dealing with the COVID and your crew and people and the locations and things. So give us kind of an update.
Well, a snapshot, Gary, is that we've tested probably 1,500 patients over the last 7 days. And we're running consistently anywhere between 17 and 19% positivity rate. So that means that every week we have several hundred new positive patients in our system.
Several hundred.
A week, yes.
Oh, gee.
So lots and lots of COVID. And we also now have school going back into session, so we're starting to see those outbreaks that are coming from schools opening back up. And in addition to COVID, we're also seeing very high rates of strep. We're seeing very high rates of RSV and just a touch of flu as well. So not only is there COVID being spread out there, but you also have those other illnesses that are popping up as well. Mm-hmm. And so I think today we have 9 COVID patients at the medical center as of this morning. At our new Council Oak Hospital in Tulsa, as you may know, we started doing urgent care there at the Tulsa facility from 7 a.m. to 7 p.m. I think day before last we saw 50 people there, and that's just, we've only been open there a couple of weeks. So we've already got a volume of 50 walk-in patients a day coming to that facility. I think that we may have one COVID patient in Okemah right now. I think that we've been trying to admit the majority of our COVID cases here in Okmulgee at the medical center so that we can consolidate resources. It's been a very tough last several weeks, though, Gary, because all of the hospitals around the state has been very full. And as you know, once these patients get to a level that they need intensive care, we have to send those patients outside of our system, especially when they get to a ventilator. And oftentimes there has not been a place to send them to. And so we've had to manage a lot of critical patients just in our emergency room. And unfortunately, we've had a few people not make it as well, that when they've got to that ventilator stage.
Well, for those people who still think this is a hoax, then no, it's not.
So here's some facts that I think is good for people to know. 100% of the people in our health system that has been unvaccinated and they have gone on to catch COVID and they have been put on a ventilator have passed away. 100%.
Gosh.
So if you're unvaccinated and you get on a ventilator, your chances of making it are almost zero. But if you are vaccinated, your chances of dying with COVID is reduced 95% if you're vaccinated. Your chances of being hospitalized is reduced 85% if you're vaccinated. So the only thing that we have out there right now that gives that good of odds is the vaccination. And so, but in addition to the vaccination, we also give the monoclonal antibody, the Regeneron. And one of the things that we are in the process right now of planning up at our Council Oak facility in Tulsa is we're going to do a monoclonal antibody infusion center there at that location, and that's going to give us the ability to probably infuse 30 or 40 patients a day.
Now, we're going to want to come back to that antibodies here
Yeah.
in a few minutes, but go ahead, thank you.
Yeah. So anyway, that's one of the things that we're very busy planning right now. We're going to open that infusion center on the 13th. And so we're spending a big part of our day trying to get that facility, because you have to get all of the IT up and going, and you need the staffing and the telephones and all of the stuff it takes to run an operation. So we're spending a lot of time doing that, and we're also spending a lot of time getting ready for the booster shots. And so, as you may or may not know, the FDA has approved a third dose vaccine for those that have some sort of autoimmune deficiency. So whether that's lupus or you have cancer and you're taking a cancer fighting drug that lowers your immune system, you're eligible for that third dose. Now we expect that the FDA is going to approve the third shot booster for everyone else around September the 19th. And so what we're being told so far is you have needed to have your last vaccine 8 months ago or longer, then you'll be eligible for that shot. So you need to wait at least 8 months between your last shot and your booster shot.
A real quick question on that. I had my first one back in March.
Yeah.
And then you're supposed to come in, was it 28 days later and
Yes.
then get your second one?
Yes.
Well, I went up there and did that, but I'm not sure they marked my card. Is that going to be a problem if I have to show somebody something?
If you had that vaccine at our facility and you're unsure, they can look you up.
Okay, good. We'll dispose of that one. I have to ask, back this horrible figure of 100% fatalities. I mean, geez, just because you didn't go get a little prick in the arm.
Yeah.
And, you did it when you were a kid, when you went to school, measles, mumps, diphtheria, whatever. We do it now when we get flu shots. We trust in medical authorities to give us the right information, yet some diehards are getting their medical information off the internet.
That's
So,
right.
Have you heard any of that? Has that run across in anything you all do?
Gary, I spend probably an hour to 2 hours every day trying to fight that information that's out there.
What are some of the crazy conspiracy theories that people have approached you with about the shot?
So this is really all over the place. Okay, so the first thing about the shots that you hear is that it's not FDA approved, and that seems to be something that people always like to bring up. So now there is FDA approval for the Pfizer vaccine. So that's no longer an excuse, and we expect Moderna will have the full approval very soon. But there have been hundreds of millions of people across the world that have now taken this vaccine, and the levels of complications have been relatively very small compared to the amount of doses that's been given. And so, once again, you just have to go back to the facts, which is if you take that vaccine, it reduces your chance of death by 95%, reduces your chances of hospitalization by 85%. This vaccine, it may or may not keep you from getting this virus. You may still get the virus, and a lot of people are going to get COVID. But the goal is to keep you from being hospitalized, going into respiratory distress, and dying. That's
Right.
what the real goal is.
Yeah, it's quite a crowd at the hospital, so it's a bad time to be there.
Yeah.
That's the biggest argument I've seen is people are like, you can still get COVID, but you will be alive.
Right. And so then probably the next biggest conspiracy that, and I don't know if you want to call it conspiracy or if you want to call it misinformation, the thing that bothers me the most is you see a lot of women who are hearing that it will give you infertility, and or they're trying to get pregnant and they don't want to get that, and so there has been no contraindications with this vaccine and pregnancy whatsoever. So we still encourage every woman to speak to their OB doctor and to make sure that they're getting those facts, but it is very safe, and we still have that recommendation that if you're pregnant or you're trying to get pregnant, you need to get vaccinated. And that's probably only going to ultimately help you stay alive if you do have a child.
Right.
Let me ask a ridiculous question here. It's always good for an interview. When you're hearing people saying, no, you're violating my constitutional right, a lot of instant constitutional scholars out there, and you can't make me, the law doesn't allow you to tell me what to do. Well, if you drive a car in Oklahoma, you got to have a license, right?
Right.
Isn't that the government telling you what to do?
Right.
It makes a lot more sense. Well, anyway, let's not get too far into that before we have people foaming at the mouth here outside the studio. The situation now has gotten to the point where we thought we had licked COVID at one point, and everybody took their masks off and went to whatever. And now we're seeing the resurgence of the COVID Delta. Delta, right?
Yes.
And what are your thoughts there on why that happened? Is it because we all got back into a crowd?
Well, I think every virus mutates. So this virus is doing what viruses do, right? A virus's job is just like your job as a human. It's to try to survive. And that's what viruses do, is they mutate in order to try to survive. And so the alpha variant, which is what we dealt with through the first round of COVID, it did what all viruses do, and it mutates. Just like the flu virus, it mutates every year. So the flu virus that you get this year is not the same flu virus that you could get last year. It's mutated just a hair.
Just enough.
Just enough, and it creates another strain. And so every time that we create a flu vaccine, one of the things that they do is they create that vaccine for this year's flu based on last year's flu. And so what you're really taking is a vaccine to last year's flu virus, not this year's flu virus. And so with COVID, we know that this vaccine was created with the alpha variant. And this thing has now mutated into the Delta. And we're also hearing that there are cases of Lambda variants that have shown up in Texas. So it's very possible that we may not ever be rid of this thing. This thing may continue to mutate and grow, and I think at some point in time, people are just going to have to get comfortable that this is something that we're going to have to protect ourselves from. And right now, the only real protection we have is to vaccinate.
And the mask?
Well, the mask...
I know there are a lot of questions about that, and Oklahoma's about to tear itself apart over that one.
Yeah, so to me, the masking is is something that I'm tired of seeing fighting over the mask. Okay, so we know that the masking is one small step in trying to mitigate the spread. So if you're in a crowded room and it has someone that is COVID positive in that room, that mask may or it may not slow the spread of that virus to you. And it's also going to depend on how long you're in that room, how long you're around that person, and there's going to be lots of factors. But we know that the mask doesn't prevent you from getting COVID. It's slowing the droplets, and it's slowing the possibility of you catching it from an infected person. But the only thing we know that stops it 100% is for you to not be around an infected person, right? And so that's, so masking is important. You should wear a mask, especially if you think that you have symptoms, and you should wear a mask if you think you're going to be around people in a room and you don't know if they're vaccinated or unvaccinated or positive, right? So that's just got to become common sense and common courtesy.
Well, let me ask you to speculate here, and underline that word, speculate.
Yeah.
You know, we've got the football season coming up, and I don't want to sound sacrilegious to Oklahomans here, but if you go into a stadium full of people, you know, what do you think your chances are?
Well, I think that there's a lot of factors. Obviously, being outside is a good thing, right? Because you have the ventilation. So ventilation with COVID is something that's extremely important. So being outside, you're going to lessen your chances. But if you're sitting up in the stands and you're around 15 strangers that you don't know and no one is masked and no one is vaccinated, your chances just went up. So the problem is you don't know. And so here's something that's different with this, that's different with COVID. In the past, you wouldn't go to the doctor unless you started having flu-like symptoms, right? So you were at home, you started getting a sore throat, it was flu season, you had a headache, you had a sore throat, you thought, I better go get tested for flu. Or you're at home, your throat starts hurting, and you think, I better go get a test for strep throat. But with COVID, if you wait until you have symptoms, you are more than likely you have been infectious maybe for days. And so that's one of the reasons why we try to encourage people that if you have been exposed, that you really need to go get tested to see if you're positive or not, because you cannot have symptoms. They call that asymptomatic, right? And so you cannot have symptoms, but you can still be spreading this out there, and you're not sick. So that's something that we've had to that we've really never had to deal with in this way before.
All right.
Yeah, so for me, it's like driving a car. You put your seatbelt on to protect yourself, but you can't, like, determine what others are going to do, right? Like, so you just try to protect yourself, you know? And so I believe, like, so many people have misinformation about the vaccine because they just listen to other people. Like, they don't educate themselves. And I think that's such an important part in, like, what we're trying to do here is educate others and our citizens, because we're already at such high numbers of deaths and low numbers of people. And keeping us alive is important, you know? So that's how I feel about it.
Well, yeah, you hear that phrase for so many reasons, you know. Well, I heard, you know, well, fine, you might have heard, but you find out for yourself. You know, what you heard might be really wrong, and the consequences are...
Like, I have a friend, she was like, I just don't want to get vaccinated because I don't know what it'll do to me. I'm like, but you vape. You know, like, how uncertain is that? Like,
yeah, we know what's going to happen.
Yeah, like, you smoke, but you don't want to get vaccinated. You know, you do a lot of unhealthy habits, but you don't want to make one healthy choice.
Right.
Nothing like filling your lungs with hot smoke.
Yeah.
Well, unfortunately, COVID has been politicized.
It very much has. Yeah.
And so that's not done anyone any favors. And I would say that if you didn't have to go very far inside of our nation to see loved ones dying last year. We lost a lot of our people. We lost a lot of Mikos. We lost a lot of our traditional pastors. We've lost a lot of our friends and family. And this virus is a killer. And we only know of one thing that's going to reduce that chance by 95%, and that's a vaccine.
I do have a question. Were you in support of the tribal employee incentive and the citizen incentive?
Yeah, so one of the things that happened is our governing board in the Department of Health, we took a vote on mandating the vaccine inside of the Department of Health. And so what it really boiled down to for us is that we have a mission, and our number one mission is to take care of our peoples during in their health care. I can't take care of people when we're not vaccinated and we're not protected. So we felt like it's absolutely essential for us to do that. If I have workers that are out because of COVID, I can't take care of sick people. And that's our number one mission. So we mandated that inside of the Department of Health. Now the tribe was a little different, and so we consulted with the chief and the second chief, and we talk about this stuff every day. And one of the things that we felt like needed to happen first, that they made a decision we were going to try to incentivize employees to get that vaccine. Because once again, if the tribe doesn't have workers, they can't serve the needs of our people. So we can't get workers to child care. We can't get workers to elder services. We can't get workers to work if they're sick. And so I think that we always want to try to keep our mission, that our first job is to try to take care of our citizens. And that's really been our mindset of why we offered that incentive
Right.
over at the tribe.
Now, the chances of someone picking up the virus is still pretty high if they don't take it, any precaution. Now, you mentioned your workers there. Can you give me a real quick capsule about how that's affected your staff? I mean, how many people are down at home trying to recover or something like that?
I don't know that I can give you any on how many workers are out, because once again, keep in mind, you can still be vaccinated and you can still catch COVID, right? It's not necessarily going to protect you from getting the virus, but what it's going to do is hopefully protect you from being hospitalized and hopefully protect you from dying. That's the ultimate goal. So we have roughly about 80% today of the Department of Health employees are vaccinated, and there are reasons why people can't be vaccinated for medical reasons, if they've had anaphylaxis reactions to other vaccines or so forth. So I think that any given day there's a handful of patients that, employees that are out. But I tell you, a big part of employees being off work right now is that their kids are having to be quarantined where they get sent home from school. So not only are we workers, we're also parents, right? And so we have to take care of those kids when they get sick and when they get quarantined. So we have to take all of those things into consideration.
One of the repercussions we learned about is the cancellation of the festival. Again, got that, folks? No Mvskoke Festival for the 2021. Can't get that out. Blah. Were you part of that decision? How did that happen? Do you know?
Well, I wasn't part of the actual decision. So my job is to supply the chief and the second chief and the council information, and then they take that information and they try to make the best decisions that they possibly can. And so one of the things that I'm doing every day is I'm giving the chief the numbers. Here's what the numbers look like today. Here's what the numbers look like over the last 7 days. Here's where we're seeing positivity rates pop up, and then they make those decisions.
Are there any major differences in symptoms between the Alpha and the Delta?
Not a whole lot. One of the things that we see with younger population is that this thing will look and act more like a cold, and they don't necessarily lose that taste and smell and taste in that first 24 hours or something. It may happen on day 2 or 3, and for the first couple of days it just maybe feels like a headache or feels like they have allergy symptoms. So we got a lot of folks, especially the younger ones, say, I just feel like that I got allergies. And then it's turned out to be COVID.
Right. I had that experience last year, but I really did just have allergies, thank goodness. So what about the third shot? Do you know when and where we'll start seeing that?
Yeah, so we anticipate that the FDA is going to give final approval for the third dose on September the 19th. And so if you've had your last vaccine longer than 8 months ago, then we'll start vaccinating from there.
So some people probably got vaccinated as early as December, right? So it would be about that time for some people.
Yeah.
What if they had the Johnson & Johnson?
So that's not eligible for a third dose. This is just the mRNA vaccine, Moderna and Pfizer.
We've heard a lot of news stories lately of how tribes have been coordinating and cooperating with the local communities. You know, the Cherokees got a great PR section there. They're in the news about every other day about this. And we, of course, are aware of the wonderful thing that happened at the expo when people were coming, you know, invited to come participate. Are we going to see any more of that? Are there any plans or anything going on right now where, say, Mvskoke Creek Nation is inviting Okmulgee in for vaccinations?
Yeah, so every day right now we probably are working with some sort of local entity. So we've worked with a lot of local school systems, and in trying to get those school-age students vaccinated and working with the local schools. We go from community center to community center, working with the local community centers. We've gone to lots of different events with our mobile clinics, and we're still looking at doing another event at the Expo Center as well. But this infusion center that we are going to have at the Council Oak Comprehensive Healthcare Facility in Tulsa, that is going to have a joint partnership between the state, the tribe, and maybe IHS involved in that as well. So we're asking them to give us resources, whether it's PPE or staffing or vaccine, and then we're going to provide the location and the majority of all of the logistical work. So there will be some help in partnershiping with the state as well.
So is there a number where somebody can call if they want some more information on this?
Yeah, so I'm hoping that we'll have those numbers up and posted as early as next week.
Okay.
And so this is literally just days old, and so once we get those numbers up and running, we're gonna get them out to the public.
Awesome.
I'm going to ask you to stick your neck out here. We're seeing this battle between the governor and school districts and angry parents and this kind of thing. Does it, politically, is flavoring this question, I presume. But what are your thoughts on mandates for masks and things like that?
Well, I don't think that it's worth fighting over. I think that. I think that what masking can do is lower your chances of spreading it. It doesn't prevent you from spreading it. Wearing a mask can lower your chances of getting it. It's not going to stop you from getting it. And so what they're really fighting about here is doing something that is slowing the spread. And so if you believe that's worth fighting over, then I think you need to find something better to fight over, because it's not worth fighting over. It is slowing the spread though. But the only thing that we know that's going to work, and the facts, and I'm going to keep saying this, you have to get a vaccine and it lowers your chance of dying by 95%. and it lowers your chance of hospitalization by 85%. And that's just the cold facts. And the chances of kids being hospitalized and dying are very small. But we have just recently seen someone in their upper 20s in our health system that has died on a ventilator. So this isn't just happening to older folks. It's happening to someone just recently in their upper 20s.
Prime of life.
In their prime of life. And in their upper 20s, they probably have school-age children. And those school-age children could have picked that up and they could bring it home and give it to someone. This kind of stuff is going to happen. And that's why it's so important that if you are exposed, you need to come and get tested. We need to find out if you're positive. If you are positive, we need to give you a monoclonal antibody to make sure that that reduces that hospitalization. And we hope at that point that you're vaccinated, because it's going to really protect you.
Well, where can somebody get tested in our area?
So we test at all of our locations. So all of our clinics all day long, we're testing all day long. In Okmulgee, we test from our emergency room department. We test at our clinic. We test at our employee health clinic. So that's going on all day. Our new Council Oak Comprehensive Healthcare Facility that we're testing there at 81st and Highway 169 in Tulsa, and so you can go to that location. Then, of course, all of our other very nice clinics.
So that's so many locations there, guys. So if you're feeling bad or you know you've been exposed, go get tested. And Shawn, thank you for coming in today. This was very useful information, and I hope somebody absorbed it and takes it and decides to get vaccinated.
Thank you, guys.
Okay, we're going to take a short pause here, and then we're going to have a Cruz from our reintegration program come in and talk about some of the latest training opportunities that have come out and are ready to share. So please stay with us here on Mvskoke Radio here on The Brew.
I started doing it when I was 11. I wanted to be just like my big brother. And some of my friends were already doing it. We got hooked fast. I just can't get enough. I'm Jacob, and I'm addicted to playing the drums.
There's lots of stuff that makes it cool to be native. Doing meth isn't one of them. Find something better to do. Check out ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Hear that? That's the sound of hope being killed by meth. Methamphetamine use is causing huge problems in our community. Hear that? That's the sound of something you can do about it. Events like rodeo, res ball, and family time can help keep kids away from meth.
Talk to your kids. Keep our culture alive. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Learn more at ncai.org.
Hey, everybody, we're back, and we have Mark Harjo with the Reintegration Program with us. He's the outreach specialist there, and we have Tim Cottle. He's with OSUIT. And what was your title again?
Fiber lineman instructor.
So you come to the Reintegration Program facilities and teach the class, right?
Yes, ma'am.
All right, and so you guys just finished a program, right?
We're in our last, they graduate next Friday.
Next Friday. And so how's that gone for you guys? How has it been working with the Mvskoke Nation and those students?
It's been awesome. Dream come true. I couldn't ask for a better place to work, and the support group from everybody I'm getting. I've got 9 students that will be graduating on next Friday, and every one of them's already got job placement. I have 5 of them that are going to Louisiana for storm damage. They're going to get to experience something most people will never get to experience.
Right offhand, huh?
Yes, right
Just throwing
offhand.
them out there.
Yes.
You think they're prepared?
Oh, yes.
Yes.
And I've got them set up with a very good contractor. And then the other 4 that the guy just called me yesterday to see if he could go ahead and take them early, and he's already got a job placement for those.
Wow. So, Mark, what was your graduation rate like compared to your enrollment rate? Was it 100%?
I'd say 90%.
90%.
Because I want to say we started off with 10 in the beginning, I believe.
Actually, we started off with 12.
Oh,
12.
And due to the COVID and with the industry just exploding like it is, equipment's hard to come by. And I could have, I noticed right off the bat that a couple of them weren't going to be able to climb, and I could have backfilled their positions. But industry standard is if you start off with 15 students, you usually only graduate 3 to 5.
Wow. So you had a good rate of graduation.
Yes, very good rate.
Okay. So, what were some of the things that you guys had them do as far as the first day to the last day? What was that process like?
Usually the first day is climbing to make sure if they can't handle the climbing portion of it, that we're able to get another student to take their place. But with some of the equipment not being there, they were doing aerial construction, basically standing on the ground. So drilling holes in the pole, putting up the support line, which is strand, and then lashing up fiber. And it's just repetitive over and over. And then I also had them freehand climbing because we didn't have their belts, but we had their gaffs. And they were doing that nonstop for 6 to 8 hours a day.
Wow.
Just constantly. And it's as bad as boot camp.
So it's tough work.
Yes, it is tough work.
So do you have to be in a good physical shape to be able to do this?
Yes. You got to be able to handle your upper body. And during the pre-interview process, shake their hand, see how firm their handshake is, and then I assess them as they're climbing poles and let them know if they need to be doing push-ups. But at the end of the day, there's nothing in the gym, anything you can do to prepare yourself for this type of work.
Wow.
Some of our best fit guys here that spend all their time in the gym are hurting after the third day.
When I had first talked to Mark about it and he told me how great this program was, I was like, oh my gosh, I'm quitting my job and I'm joining. But now I'm glad I didn't do that.
Well, I tell all these students, I've already got job placements for anybody I can graduate.
Right.
100 anywhere in the nation. I'm in my 45th year doing this, so I've got a good resource across the nation. And these, I tell the students, the only limitations that are on you are those that you put on yourself or you allow others to put on you. And they can make some very good money.
Yeah, that's what I've heard. So even some of these guys going into an emergency situation, do you think they'll be making more money than normal?
Right now they're going in as standby. They're going in to help the power crews. Because I think there's between 2 and 3 million people without power. They can't restore the fiber until they get the power up, and all the transmission lines are down. So they'll be going in as ground hands, help clear right-of-ways. But storm damage, they could make 5 or 10 times more than they could normally make anywhere else.
Wow.
And then to prepare them mentally for going into that, it's literally like going into a third world country because there is no electricity, no internet. You may have to sleep in your truck for a month at a time in the cab of your truck. You have to deal with the depression, knowing that you get to go back home. You're working right there at their homes.
Yeah.
And they have to live with it for quite some time. So preparing them mentally for that type of atmosphere, because after the third day, depression sets in real bad.
Really? So you have some experience in that?
Yes, I've worked every ice storm, tornado, and hurricane over the last 30 years.
So Mark, from your perspective, what is it for you to... We're squeaking. From your perspective, what is it like for you to have people in your program graduate this?
It's great to see these guys succeed. Some of them had initially left the program, but then once we told them about this, what they could do, how successful they could be, they came back to our facility to take this program. And then, like I said, it's just great to see those guys, follow through with it, keep their word to us, and going out and just, making something of themselves.
Do you kind of want to give a little background on your program and what you guys do for the community as to why it is so important for these guys to have this opportunity?
Yeah, like I said, our program, we help just about any Mvskoke Creek citizen that's being released from incarceration within the past 2 years. Like I said, this fiber technician training program, it's probably the most popular thing that's getting everybody drawn to our program, wanting to be a part of our program. But you don't necessarily have to be a reintegration participant to take this program. You could be of any tribe. You don't even have to be Native American. Just as long as you can provide a funding source to cover the tuition costs. But we will assess the Native Americans, the Mvskoke Creek citizens, and our reintegration participants first, before accepting those that aren't of any tribe or a participant of the program. Just because our program is built to help those guys coming out of prison, get them back on the right track, and this is a great opportunity for them. It keeps them busy all day long, and so by the time they're finished with it, they're going to be wore out. They're not really want to go do mess around, do anything crazy. But yeah, like I said, it's that's one of the main things that we provide. But we provide housing for these guys whenever they come out down in Henrietta at our living facility. But we could also provide housing outside of the living facility as well if they have a family, kids, a wife, just as long as they have full-time employment. Another thing is, clothing, driver's license reinstatement, because, these guys are going to have to, get their license being a part of this program, or even when they finish it, because I do believe they have to get they must be able to obtain a CDL. Is that right, Tim?
On here it says CDL, but it's not a requirement. But if you do have your CDL, right now the guy that's taking a lot of my students is checking to see if they do have their CDL, because he's got to go down to Texas and pick up bucket trucks and then take them down to Baton Rouge.
So it's just a lot more beneficial to have that extra credential. What are some of the other credentials they can earn while doing this program?
Certified lineman, aerial construction, bucket truck aerial lift certifications, OSHA 10
and CPR.
and CPR certifications.
And does that open up a lot of doors for them as well?
Yes.
In other areas of work?
Yes.
Yes. So what are the major companies you're sending your graduates to?
Right now, we're using Benton, who's the prime contractor, and then some of the subs there is Ryan Hoffer. The big one is Steve, I can't think of his last name, he's with Celtic.
Okay.
And he's one of the better ones around. Irving Cable, I got Power Co-ops that's wanting some of the students.
So you just have a large network of
and then
so
I'm getting
many
phone calls from telephone companies that's wanting my students. Company out of California and New York as well. I'm getting calls from all over.
You just can't keep them full, can you?
No. Starting at the first of the year in January, there was a shortage of 280,000 linemen just across the nation.
Oh, wow. And was that due to COVID, you believe?
No,
or?
It's baby boomers retiring.
Oh, okay. Yeah, they're getting out of their working years, ready to retire.
Right.
Yeah, I get that. So isn't there plans for a future course coming up?
Yes, we're actually going to be starting one, I believe September 20th. That's the set start date right now. It should be finishing up early December. And then after that, I just received word that there might be a possible fiber splicing class in March. Because, I mean, this is, fiber technician, but what I learned from Tim, just him being here and, everything going on, that there is a difference between, being a lineman and doing splicing. I just thought, it was just, one whole thing you had to learn, but I guess you can learn different fields of being a fiber tech.
Okay. And so you said you're sending some of your guys to Louisiana, right? Or
Yes.
they're being sent there
Yes.
through the company. Has there been any help for any Louisiana tribes down there that you're aware of? Are you guys able to help any?
That I don't.
Mark, do you know that?
I don't know.
No, don't. You're like, I'm in Oklahoma.
Yeah.
No. So is traveling a huge part of this job? Is that something somebody would need to consider?
It can be. What's good about this area, there's so much going on. I've got 4 co-ops that want my students just within basically a drive where they could be back home with their families, or on the weekends if they get their kids every other weekend or whatever. So I give them the option. If they have families, I recommend they to kind of stay close unless they're able to travel with them. Otherwise, there is better money out on the road.
Oh, okay. What is the pay scale like?
Oh, that is wide open. I push these guys hard because I really tell them you set the limits on yourself. Mm-hmm. Steve that they're going with, there is no limitation. She can work 7 days a week, 356 days a year. He's got 2 young men working for him. One's 19 and the other one's 20. And the 20-year-old, in 2 years, each year he's exceeded $300,000 a year.
Wow.
So somebody can go from being an inmate to making $300,000 a year.
Exactly.
And their life can change like that through this program.
Yes.
Wow. So.
And some of them are already out in the field working for him right now.
Really?
And he come to the class, and he wanted the 2 students. After he saw the 9 students, he said, he goes, I want all of them. He goes, they're so that much farther along.
Wow. In just
we don't do
12
textbook.
weeks.
We're out in that open field in the heat of the day, all day long.
Mm-hmm.
I don't sit in an air-conditioned office. I'm out there with them, and hands-on teaching, and it's very, very strenuous on the body. But if they can make my class, they can go to work for anybody. Mm-hmm. I'm not hard on them because I want to be. It's because I have to be, because I'm going to push them to their limits and bring out the best in them.
Awesome. So you're going to have another one September 20th. How can they sign up?
They can go to our webpage on the Mvskoke Creek Nation website. It's under the reintegration page. There's an online e-form where they can just go in there, fill it out, submit it, and it'll automatically be sent to me. And then, like I said, we'll just contact them to come in and do the poll assessment. And, we do want to, reiterate to everyone that, just because you come in and do the poll assessment, you climb it, you come back down, doesn't necessarily guarantee you a spot in the class, just because, you did well. But, there's still some other things that you're going to have to do to be in this class, such as, securing that funding source. And then there's also a formal interview that falls along with that.
And there's some testing, right? Like drug testing and physical testing.
Yeah,
right?
and the poll assessment is the
test?
physical
Okay.
test, really. And then also passing the drug test as well.
So is this offered at OSUIT as well, this class? Or is this specified for?
It's located at this area, which it was originally started just for the reintegration program, but then Mvskoke tribal members, but then they opened it up to any Native American, and then from there to, I guess, basically the general public.
Yeah.
Which is it's a good thing. That way we can keep it coming in. And I knew this was going to explode because there's not very many schools across the nation that offers this.
Oh, really?
Yes.
Wow.
I can't graduate enough. I cannot graduate enough students for this. We're just in this area. We're going to see this type of work for the next 10 years.
Right.
And then there's going to be rebuild and
Ever-evolving.
and then maintenance work and all of that type. So
how many are you going to fill in this next? The same? Try to do 12?
12 to 15.
12 to 15?
And we will already have this class full, and then possibly the next class is already full.
Wow.
And I do not want anybody to ever get discouraged because they didn't make the first class, because in 10 weeks there's another class coming on. Mm-hmm. Unless I decide to flunk all these guys, because I don't want to lose these guys.
So some of it's paid, though. Some of the coursework, right? It's like a paid internship.
The internship is paid, yes, ma'am.
Yeah. How does that go? So you do 8 weeks in class, 4 weeks paid?
Yes, it's 4 weeks paid. And the pay scale there is ranging anywhere from $17 to $38 an hour.
That's pretty good money, even at the bottom dollar.
Right.
Yeah.
Plus you're using all of their equipment and everything. You don't have to go out and buy all this stuff.
Okay, yeah, and you're getting
So
that hands-on.
there's a range, and I always try to tell them, don't go to work for hourly wages. Even if it's $50 an hour, you're killing yourself. Go on production, because that
Okay.
helps motivate you and drive you and push yourself even farther.
That's good advice. So is there anything about this program that we're missing that we haven't talked about?
This class is open to anybody and everybody. And I interviewed some last week, and they were saying that, well, I can't do this because of this or that. Or I've heard young ladies come in and say, I can't do this. I said, why not? Because I'm a girl. Why are you putting limitations on yourself?
Yeah,
And
I think that's people really want to do something, but then do they really want to? And you have to really want to do
right,
something like
and
this.
I find that
Yeah.
out in the first 2 days.
Yeah.
As long as I've got the equipment there, I can find it out in 2 days if they're going to cut it or not.
How was the attitude of this group you just graduated? Were they very determined?
Yes, ma'am. I couldn't handpick a better group of students.
Really?
That's why I want to flunk them and keep them again. I even said, I think I'm just going to quit teaching and hire all these guys myself and start my business.
Go start
back
your
up
own
again.
crew, huh? Yeah.
And all of them asked me, they said, well, boss, if the money's that good, why are you not back and doing it? And I said, you know what? I asked myself that same question. I said, but I've got a heart to teach and want to give back. And these students, I don't look at them at what they are, but what they can be.
Yeah, I appreciate that. I appreciate the work you're doing in our community. Like, I really back the reintegration program. I have a lot of family members that come from that kind of, background, and unfortunately, some of them never do anything, so
Right.
it's really good to see it happening.
This is absolutely a life changer for these young men.
Mm-hmm. Did you bring your list of graduates, Mark?
I did not.
I might have it on my email. I just thought we might want to give a shout out to those guys. Do you know some of their names?
Off the top of my head, yeah. I know there's Montel Fox, Dathan Leaf, Nathan Quinton, Sage Bennett, Ernest Morgan, Brian Alexander, Ricky Harjo, and Joseph Brown. Yep, those will be our 9 students graduating next Friday.
Awesome. And so about 5 of those were your program
Yes, 5 of
participants.
them were our participants, and 4 of them were outside.
But they were also using Mvskoke Nation.
Yes, I do believe so.
Okay.
They utilize employment and training, and for anyone that that is worried about finding a funding source, there's employment and training. They have the grant programs, and then they have the classroom training, and just this next go around. I do believe Seminole Nation provides some assistance with paying for that stuff as well. But it's just, it's really just up to these guys to, complete the paperwork, do everything that they need to do. We'll submit all the documents we need to for them to receive that funding. I know, some people don't qualify for either one, and, they're having to pay out of pocket or have their parents help them, or we actually had a couple people trying to go get loans from the bank just so they can take the course.
How much is the funding source? I don't think we've covered that yet.
It's $3,100.
$3,100.
And we had 2 students show up, or 2 prospects show up. They thought it was $31,000, and they were going to go get a loan.
Oh, Jesus.
My
They're
son-
ready to make some money.
My son went through the power lineman course here many years ago. It was $88,000. If you went to go get this type of training, it's going to cost you in the $20,000 or more so. What's unique about this, you will not find another place in the nation. I get with all those guys, those companies that want my students, and you give me your specs, and I train them to their specs. So when they get to the field, they're ready to jump in and start working right then. Because every different engineer, every different electrical company, co-op, power company, all of them have different specs. So I customize the teaching to where they're going. You will not find that anywhere else. I don't care what industry it is.
Yeah.
But it's working out very well.
Good. I'm really glad to hear that. It's really, really a good program, guys. You can apply. Can you say it one more time, Mark? How you can apply for this?
Oh, yes.
Sorry.
You go to the Mvskoke Creek Nation website and then go to the reintegration page. We have the online e-form link on there.
All right, well, we're wrapping it up here today. I appreciate you guys coming in. Super good what you're doing for the community, for these guys. And hopefully you have a really great next course.
Thank you.
Thank you.
You might catch me in there. No.
Bring it on. Yeah, because we actually had, I think, 2 women that are going to be in this class.
Really?
It's about to start, yeah.
Wow, that's crazy. Are they in your program?
One of them is.
One of them is?
Yeah, one of them was an outside person that just stopped by the office.
Man, I would really do it if I didn't have kids. I mean,
Yeah, I knew it paid good, but I wasn't aware of the 300,000.
Okay, thank you, Morgan, for bringing this wonderful crew in for this really useful interview. Good Lord, they're making nice money.
I know. I'm so jealous.
You don't need Carhartts, so you can make a bundle of cash. Well, let's get out of here. You've been listening to Mvskoke Radio here on 1240 AM and 106.3 FM here on the brilliant, beautiful Okmulgee. One quick
We have an announcement. The 7th annual Mvskoke Spelling Bee will be held September 11th at 10 a.m. at the Eufaula Community Indian Center. The address is 121 High Street, Eufaula. Prizes will be awarded to 1st, 2nd, 3rd, and 4th place. And for more information and study guides and rules, please contact 918-732-7649 or 918-457-6671.
You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. But